Thank you all for joining us today. Very important updates about where we are in Colorado, and very importantly, I know everybody's asking about the path ahead, how we live our lives in May, how we plan for May, how we plan for making sure we take data-informed, science-informed decisions with regard to how we're living our lives and how we all minimize the risk for ourselves and our loved ones. First, a quick update, 10,868 confirmed cases. We have 506 deaths today. Colorado passed the 500 death mark. We knew we would. There's many more ahead, and our hearts go out to the families of the loved ones of those who've lost their lives due to this deadly virus. I know everyone's eager to hear a lot more about this next phase, the safer at home phase. And I want to reiterate, as I've said a number of times, this is not in any way going back to normal. It's not going to go back to the way we lived our lives in January, February. It's how we can have a sustainable way of life for May and very likely with modifications beyond, a way that we can get the health protection we need, the psychological ability to endure, and the economic ability to endure for families who need to put food on the table. Safer at home for Coloradans means we need to continue to limit our social interactions to the greatest extent possible to just individuals in your household, same as before. And for those who know, the most vulnerable are people 65 and up, people with chronic illnesses. And for seniors and those with chronic illnesses, May is going to look just like April. It's just as dangerous. It'll look just the same. And we need to make sure that our seniors, those who have pre-existing conditions, stay at home except when absolutely necessary. Really, your lives, the lives of those who are most vulnerable, including our seniors, will look the same in May as it did in April. Our success as a state in keeping our loved ones and fellow Coloradans safe is about personal responsibility and doing what's best for our communities. And doing what's best means taking extreme precautions. That means wearing masks when you are out and when you're interacting with others. It means limiting your social interactions as we reintroduce many of these activities back into our lives that are necessary for the long haul. Let me show you a little bit about what that's going to look like. As I mentioned, vulnerable populations, older Coloradans, stay at home except when absolutely necessary. No gatherings larger than 10 people. Critical businesses, of course, remain open. Those are the ones you have been visiting. If you've gone out at all, grocery stores, et cetera, remain open. Social distancing, masks for employees, more frequent cleanings. And then the other retail businesses open first for curbside delivery on the 27th, and then phased in public openings with the strict precautions, some similar to those precautions you've already seen, hopefully, at your local grocery store. And as customers, you should, of course, be wearing masks. The people in the stores will also be wearing masks, but that's a very important piece of making sure this works. And restaurants and bars remain closed. We're still developing what those guidelines will look like. We just don't have a trigger date, right? We don't know when that will be safe. They'll continue with takeout and delivery, of course, and then we work towards a phased reopening. We're certainly not ruling out that phased reopening during this period. These larger social environments, nightclubs, gyms, spas, remain closed. Elective and dental procedures begin again. Strong precautions to make sure that we have adequate personal protective equipment. Masks are needed for those, of course. Medical grade masks, for dental and elective procedures, of course. We need to make sure that whoever's providing those services have those before they're able to proceed with those. Because, of course, we needed so many, and we continue to need so many masks for the COVID patients at our major hospitals. Personal services, that's like salons and dog grooming and personal training, open with strict precautions. We did announce the other day, I talked to all the superintendents on the state on a call, our kindergarten through 12th grade schools are not reopening for this year. Everybody knew that was likely. Almost every state has already made that decision. While we are working on what those social distancing practices need to look like, implemented in an educational environment so they can resume in classroom in the fall. It's very hard to roll them out at the end of a school year, meaning it would take working with the staff and training them, even if we rushed and we got them issued next week, The staff would have to, instead of doing online, they'd have to learn the new way of teaching and doing it and social distancing, and then there'd be like 1 week left of the school year. So and this was at the request of many superintendents. We just made this call and said, look, we're going to focus on preparing in classroom for next fall. Let's focus on the online and everything else we're doing for the final few weeks of the school year to make sure the kids are ready for that next grade level. And of course, telecommuting continues for anybody who can. But starting May 4th, up to 50% of the staff can work in person at offices, commercial offices, but there's some offices that can keep up 80, 90% telecommuting, and the state as an employer is one of those, right? We'll see what our number is. Right now we're at 70 to 80%. It might come down a bit, but it'll be our goal is certainly more than 50% will be able to telecommute. So hopefully most businesses can have more than 50% telecommute. That's the goal. That's what you want to shoot for. But for those who need to, they could have 50%, of course, come in. And if it's a type of business where everybody needs to come in for it to work, there can be staggered shifts, meaning you have half at one time, half at another. Social distancing, physical barriers, all of those types of strategies and tactics that can help make sure that workplace is safer. Next slide, please. So what Safer at Home is continuing to stay at home as much as possible. And when you do leave, you leave for those specific tasks. You go shopping, you go to work, you go home, you're recreating near your house. We all need to be very conscientious about how we do this. Stay at home except when you need to leave. And for those over 65 and with a chronic condition, you need to stay at home except when absolutely necessary. Just like last month, same as next month, it's just as dangerous out there. And we need to make sure that we're doing everything we can to keep you safe. Continuing to wear a facial covering and mask, very important. For this to work, people need to wear a mask when they're interacting with others. That doesn't mean when you're doing your yard work alone in your yard, but it means when you're going to the store, when you're walking or biking on a trail that others might be on. Wear a mask, very important. Not when you're alone, you don't have to do that with your family, not in your yard, but whenever you're interacting with others outside your household, masks are extremely important. And then recreating close to your home, about within 10 miles, meaning you're using your parks, whether it's a municipal park or county open space that's near you, not traveling to other areas of the state to recreate. And of course, continuing to limit interactions to the extent you can with members of your household. Just as important, what Safer at Home isn't. It's not any kind of free-for-all. It's not an opportunity to go out and get the virus and spread the virus for too many people. I mean, it's not an excuse to turn this into some kind of vacation. It's a pandemic, not a vacation. Not having parties or get-togethers, not having unnecessary travel. All of those things. There'll be a day, we'll be able to do them, we'll get through this, but to get through this, we need to forego some of those things for May. And I know that we all understand that, but just resist that temptation. We need to resist that temptation for a month. I want to present this in Colorado fashion, what we're talking about here. Here's another way to visualize it. We're on the bunny hill right now. The next step is a regular old green run, green circle. We're not doing the blue runs, we're not doing the blacks or double blacks. We're keeping it gradual. Here, and we're ready for this challenge. We're going to do it, and we're not going to fall down and hurt ourselves. We don't want to go on to a double black diamond or a terrain park or anything like that, because we will get seriously hurt. So that's one Colorado way of putting it. Here's another Colorado way of putting it. If you're into mountaineering rather than skiing, right now we're at the trailhead. Let's say the trailhead's 8,000 feet of elevation. We're not gonna summit it right away, right? We're not going all the way up. You haven't trained, you don't know it. We're not sure. We have to check the weather, the time of day. We're not summiting the 14er right now. We're going up another 1,000 feet. We're gonna feel it out. And then, you know what, if we're okay at 9,000, 9,500, we're gonna check out when we're comfortable to do the peak. But we're not doing the peak right now. We're ready to go up to a higher elevation, challenge ourselves. We're gonna do it safely together and do our best. I know we're having a little fun here in a Colorado way, but I'm doing this to make a point. We need to manage our expectations and manage our behavior in the coming months. And, in this case, month, but we know that while we hope June will have more ability to do the things we love, we don't know that yet. It'll still not be a free-for-all, right? This is May we're talking about here. We're going to do this in a manageable, sustainable way. And frankly, if we don't succeed at the stay-at-home phase, if we're falling down left and right on that green circle,
it does mean back to the bunny hill. It means that some of the things that we're doing have to be further restricted because people aren't doing them in a safe way, right? So people need to wear masks. We need to do everything we can to avoid social interactions. I know we can do it. It's a matter of individual responsibility. It's a matter of our actions that we take affecting ourselves and affecting others. When we determine what activities are being reintroduced and the timeline for them, a lot of that hinges on the potential risk of spreading the virus in each scenario and how best we can mitigate that. That means the scientists are weighing in the transmission risk of each activity. You know, for a personal activity like dog grooming, it was not open during this critical phase. It was not allowed during stay-at-home when people had to stay at home, but it can be done with very little social contact. That's why it's in this area of the graph. And we're going to ask, of course, dog groomers to set up a practice for contactless drop-off, minimizing interactions, pickup, payment, all of those things. It's a little harder in a retail store, but we've seen great innovations already. We've learned a lot from those essential retailers that have been open this last month, best practices in grocers, in pharmacies, in so many other stores. That means taking precautions like one-way aisles, right? Think about it, where rather than passing several people are going the same way, they're maintaining the distance, they come back through the other aisle. Of course, mask wearing. And you know, making sure we do that in a safe way, cleaning, et cetera, very, very important. Now, to compare those that are going to be happening in May to stuff that isn't happening in May, like a Rockies game, right? 20,000 people. Gosh, we hope 60,000 people when we're in a pennant race. People that are packed in closely, eating and drinking. Very difficult to get the hygienic and distancing practices right. And as much as it pains me, while we hope Major League Baseball has a season this year, and they're very thoughtful about how they do this, it's going to be in a different way if they can pull off a season, right? And that's why they're having those discussions about whether they use spring training stadiums and just have no audience or exactly what they're doing. But that's why that shows sporting event as a high exposure risk. That just is by the nature of what it is. 20,000, 30,000 people all together, food and drink and fun. We'll get there. We all can't wait. But that's not May. It's not just about the customers, these protections, right? The folks that are getting their dogs groomed or their hair cut or shopping in a store. It's also about the small business owners and the workers and store clerks and everybody who needs to earn a living. So everybody has the same interest in staying safe in this, whether you work in a store, whether you want to go to the store. We all have this absolutely critical interest in being able to do this in as safe a way as possible. So I want to go over some of the major guidance that both individuals and businesses need to have to make this next phase as sustainable as possible. I'll go over them at a very high level. There's going to be specifics that are outlined by public health around these practices in each area. As consumers, as individuals, you don't need to know them. If you run a salon, if you run a store, you'll need to know those specifics. That's all happening in the next few days and this weekend. But I'll go over this just at a high level. And by the way, there is a consumer, that means you, if you shop in a store, you have a responsibility too. You should wear a mask, right? And you should also respect the social distancing in that store, in that environment. It is about your health. It's also about the health of those who work there. Please make sure we're helping to keep those who work in retail safe, just as you have been doing, hopefully, for those who work in grocery stores and pharmacies and the businesses you've been frequenting. You want to stay safe. You want them to be safe. We all want to be safe, and we're doing it in the best way we can. For the general public, face coverings, so important, staying 6 feet apart, no social gatherings. If you're sick, you don't go to work, right? Any symptoms, you are not going to work, and then avoiding unnecessary travel. And then for vulnerable populations, it really looks just like this last month. And I know that pains me and it pains you because grandparents want to visit with their extended family and their grandchildren, and they want to see everybody, and folks with pre-existing conditions want to go back to normal. But it's absolutely critical that we take these precautions. I mean, we don't, even in your own family, you don't want to be short-sighted where grandma can see everybody this month, but that might mean she can't see anybody for the months and years ahead, right? So let's be careful this month. Use Skype and phone and Zoom and talk to them and bring everybody together virtually. But we need to keep our most vulnerable safe, and there will be a day. We want to make sure that they are there at the day when we can have fun with our extended families and friends again, and that day will come. Let's make sure that as many of our parents and grandparents, as many of those with pre-existing conditions are there for that day as possible. And that means extreme precautions in this month of May. This is, what does it mean for seeing your friends and family? It means you should limit your social interactions, right? And when you absolutely do see, when you need to see people, when you see people 6 feet apart, wearing masks, I know that's awkward, but make that the norm. That's how we get through this, right? Sticking to solo, non-contact recreation activities. That means solo or with who you live with, your roommate, your family. That's fine. And running, walking, hiking. Not traveling outside your local community for recreation, avoiding contact sports, and sharing equipment. Common sense, but we need to do it. We need to pull it off. And remember, industry best practices for these workplaces that have been closed and offices that have been closed, they're going to be opening at no more than 50% capacity. And of course, should allow employees to telecommute whenever possible. And if during the stay-at-home, you were able to have 100% successfully commuting, you should keep that up if you can. Some offices can do that. But out of necessity, some might need to have 20%, 30% that have to come back in, are able to do it in a safe, socially distanced way. And yes, up to 50% for this safer at home phase for the businesses that need to. Here's some best practices that you should implement at your workplaces to protect yourself, your employees, your customers, the public at large. Having at each workplace somebody who is a coordinator in charge with addressing the COVID-19 issues, maintaining at least 6 feet, hopefully 8 or 10 feet whenever possible. Sanitize the high-touch areas regularly. Signage for employees and customers about good hygiene, washing hands. Open windows, fans, ventilation is very important. Open windows where possible. Hopefully there'll be good weather out. Ventilation helps. Always avoiding gatherings of more than 10 people. Implement a symptom monitoring program, and this is for mid and larger businesses in particular, but for the smaller ones that can, you should. That means workplace temperature monitoring when people enter whenever possible. And it really works. Here's what this did for us. We've done a number of these press conferences at the Emergency Operations Center. We had a member of our leadership in our Emergency Operations Center get flagged for an elevated temperature when he came to work. Didn't have symptoms, didn't know he was sick, elevated temperature. He went to get tested. He was positive. We quarantined all his contacts at the Emergency Operations Center for 14 days. We avoided an outbreak that could have affected and likely would have affected tens, dozens of people, actually probably gotten in the way of our own state's emergency response. Thank goodness we stopped that outbreak. But that's what more and more Colorado workplaces should look like. That temperature monitoring, the questions are a key part of making sure that people are as safe as possible. And of course, for employees, making sure that you stay at home whenever you're sick. Stay at home with any symptoms. Encourage, do remote work wherever you can, and wash your hands regularly, use sanitizer, wear masks, and take on that additional responsibility. And for customers too, if you're going into a business, making sure that you have that distancing at retailers and are doing your best to honor protecting yourself and others. Now, some industries will have specific practices that we're looking at with a health lens, and those include retail and offices and medical and dental and childcare and education and personal services, real estate. Those have industry-specific guidance that is coming out in the days ahead because you want to be as safe as you can. And we're going to give you some parameters to do that. And that's going to be a very important part of making sure that these areas are able to function in a sustainable way. Look, many local communities, especially those with large populations in areas that have hotspots, might have more restrictive rules in place. That's completely appropriate. It may be a county or community-wide rule, or it may be a facility-specific lockdown, because there's an outbreak at a facility and there's a number of people associated with that facility that might be in quarantine for a period of time. So work with your county health authorities. There will be times that based on real life evidence and information, they might need to be more restrictive. So too, communities will have local flexibility to make that work. And that means, of course, staying consistent with our state, but they can go further. Every city and county, of course, should have that flexibility to meet their needs. And that means that if they want to relax guidelines, They can apply for a waiver from the Colorado Department of Public Health and Environment. Just common sense requirements there for that waiver. They need to, of course, show that they have a low case count or demonstrate a proof of 14 consecutive days of decline, just a threshold issue. They're not going to be doing this if they're on the upswing, only if they're on the downswing. And secondly, the written county COVID suppression plan, the county plan needs to be in place. It needs to be thoughtful, approved by the appropriate county health authority, hospitals within the jurisdiction, and elected leadership, the county commissioners within the jurisdiction. So just that thoughtful way. There will be times your county health department has to do more in a targeted way, perhaps countywide. There will be times that they want to allow more flexibility. That's wonderful, as long as, of course, you can meet those guidelines and your hospitals and others are on board. Here's a little bit about the timeline I rolled out a few days ago. There's some people ask me questions and they're a little confused about what happens when everything doesn't happen on one day. The stay-at-home order ends the last day of it. Sunday, April 26th is stay-at-home, right? That's also the day that we'll be releasing some of the high-level guidance about the future of the next month and the next week. So what does April 27th look like? Not terribly different than April 26th. I mean, you're still safer at home. We want people to stay at home, but it means that retail businesses can begin curbside delivery if they want. So that means that they're able to have some of those workers get a chance to earn a living. And during that few-day time period between April 27th and May 1st, they're also preparing those stores if they want to reopen for the public on May 1st, right? So people can go back to work if your retailer wants to reopen April 27th, curbside delivery, real estate showings can resume. May 1st, if they've implemented those best practices, which they hopefully were doing those last few days, it might include decals and ways of doing business without having proximity, then the stores who want to open, some will be open, and many personal services will be open as well. And then May 4th is when office workers, up to 50% of a workplace, are able to go back at reduced density. That's very important. But it's not a contest to see how many people you can have go back to the office. I mean, this is the challenge for employers. If they can telecommute, they should still telecommute. It's wonderful if you have a kind of business where 70, 80% can telecommute. By all means, keep that up, right? But if you absolutely can't, and I understand that, some businesses will go out of business and the jobs won't be there for folks if they can't go back. They're able to go back at 50% capacity and with those best practices to be able to do what you need to do to be able to get business done, keep those jobs, keep earning salaries. Very, very important. That's May 4th. I know everybody's chomping at the bit, but we need to get this right if it's going to be successful. So it's incredibly important to get this right. Every state, every country, we're all charting new ground here. We're making the best, most informed decisions we can, but we can only offer the guidance, the orders, the information. It's up to Colorado to get it right. I know we'll get it right. I know we'll get it right. And our workforce is growing. These are some of the things that we've been doing. We'll go to the next slide, and I want to clarify some of the things from Monday's presentation. First of all, we would never classify this as any kind of grant reopening, and I think you know that, right? I've said probably every single time, we're not going back to how we lived in January and February and taking all this for granted. We would be on an exponential curve. There would be tens of thousands of fatalities in a very short period of time. We've seen this happen elsewhere. Colorado, as special as we think it is not special in that sense. It would happen here. If we did that, and that's why we're, of course, not having some massive grand reopening and going back to how we lived life last year. That day will come. That day will come. Big neighborhood parties, nightclubs, sporting events, it will come. But it's not now. It's not May. It's not in our immediate future. Second of all, the primary goal, as we described it at the time, of the stay-at-home order, was to reduce the spread of the virus, to knock down that exponential curve, which would have made, New York lost 14,000 people in 3 weeks. I mean, and they're only 50% bigger than Colorado, New York City. I mean, people think, oh, New York, it's so big. It's like a Colorado and a half. Now they're in one city for 14,000 people, and they're losing more every day. First of all, we wanted to make sure the hospital bed capacity is there. And by and large, that's increasing. We now have, or are bringing on board soon, 600 beds at Denver Convention Center, 250 at the Ranch in Loveland. I really hope we don't need them. I really hope we don't need them. But having those 850 beds gives us more confidence that Coloradans won't die because we don't have the simple medical interventions that can keep them, that can save them. If we're successful, we want to make sure that Coloradans who contract COVID-19 have the fighting chance of making it through it. And there's still good news, 9 out of 10 won't need to be hospitalized. That's wonderful. But for the 1 in 10 who do, we want to make sure you have the oxygen you need, the first-line treatments you need, and for some of those worst cases, even ventilators, we want to make sure that we have them there so you have that fighting chance of getting out of that hospital on your feet rather than getting out of that hospital and being buried. Most of the hospitals are reporting their PPE and ventilator levels. They're fairly stable right now. We think we've bought enough time to be comfortable that the supply chain will meet our needs. Still a lot of challenges there, we know. And I want to talk a little bit about testing, because this seems to be the buzz of the national and local media. Testing, and containment. This is one of the 4 things we need to do, right? We've always been very clear about this. We've been a little bit more explicit about the 4 things. We need to succeed at all of these. One of those is increasing testing and containment and tracing. The other is wearing masks, protecting our most vulnerable populations, and ongoing social distancing. They're all important. We're going to talk about them, but I just want to put this in perspective a little. While testing is an important tool, we're working on it every day, and I have some updates. It's not a panacea. It doesn't solve this. We can't just test and trace our way out of this in any model that we've seen, that I've seen, that's credible. Let me show you what we're talking about. The modeling we've done takes into account the 4 factors: distancing among the general population, the social distancing is so important, the extreme measures we need to take to protect our most vulnerable, the additional distancing for people 65 and up and those with pre-existing conditions, wearing facial coverings to the greatest extent possible, so incredibly important, and then the increased testing and isolation services, right? Not just the testing, because if you are sick, you should be in isolation anyway. It's the additional work around the notification of the contacts and everything else that occurs that can really help prevent the spread. Ideally, we have a sustainable level of all 4 in place to maintain the capacity of our medical system to save lives and make sure that people can earn a living. If we have more distancing, then they all are variables, right? If you have more distancing, you might not need as much testing and isolation. If you have more testing and isolation, you might not need as much distancing. All important, they all play off each other, they all interact with one another. Ideally, we have a sustainable level of all 4. If they're working well together, then we can ratchet down and allow some of the other activities like restaurants at partial capacity sometime during the month of May. It's certainly a hope that if the data bears out, we'll be able to achieve. But we did test the scenario just so you can see what it looks like, because people are saying testing and containment, so important, which they are, one of the 4. The most aggressive level of testing and containment we could even realistically get to, let's say somehow you could get to 80% of symptomatic patients within 48 hours. Remember, symptomatic is only part of who has it. There's still people who silently spread it. But let's say you could somehow get to isolating 80% of symptomatic patients within 48 hours. That would be a home run for testing and containment. What this shows is that still doesn't meet our goal of making sure that our hospital system in beds is not completely overwhelmed. We would fail if we just had 80% of success in isolating symptomatic patients through testing and aggressive containment. And to be clear, that would be a great success in that one area. But if we succeeded in that one area and didn't have anything in these other areas, it would be a massive failure. It would mean that the ICU capacity was completely overwhelmed. Our ICU capacity is 2,000 people, and we would have a peak of 12,000 if that was the only thing we were doing, testing and containment. So we have to do it. We're doing a lot. I have some great updates on the testing and containment, but there is no one strategy that can get us there. This is actually what was most shocking to me from the modeling. Maintaining the stay-at-home order for an additional 2 weeks or even 4 weeks delays the peak, but it doesn't really have anything more than a negligible impact in the severity of the peak. The peak is essentially the same, it's just a little bit later. That means if we were to maintain stay at home 2 weeks, 4 weeks, 6 weeks longer, it doesn't matter. It inflicts very severe economic pain on people, but also hurts the will and psychological ability of the people of Colorado to be in this for the long haul, in exchange for really no reduction in the number of ICU beds that we need at the peak of the crisis. And that was very important takeaway from the very comprehensive modeling from Dr. Samet. Again, we look at all models. I look at all models, national, international. We're so thrilled to be able to have this Colorado-specific modeling from the Anschutz School of Public Health Dr. Samet, who I call, Colorado's Dr. Fauci, but he has the added benefit of having his clinical training in pulmonology, lungs. I mean, very relevant to this clinical condition. That's what he came up through, but he's a public health guru, and we really value his input here in Colorado. Now, let's look at scenario F. This is where we have all four factors working together. This is what we're doing, what you will do and help us succeed in. It's why you need to wear a mask, why you need to continue social distancing, why we need to protect our most vulnerable, and yes, while we are working with you on increased testing and containment. This shows what we can get to and achieve. It shows the model, just to be clear, older adults are continuing the extreme social distancing 75 to 80% that they did in April, just like May. Right now, we're isolating about 33% of symptomatic cases in the state within 48 hours. Scenario F builds in the model that you saw the other day. It builds in that we're increasing our testing and containment every week, and I have some great updates on that, but we have sort of modest goals built in here. I think we can beat them, but it shows an increase of 5% per week starting next week when the stay-at-home ends. That's a realistic goal given our knowledge of the supply chain, our testing equipment, the ability that we think we have. We think we can meet or beat that. And this is only detection and containment of the infected individual. There's additional bonus points, if you will, in the model that could be recognized as we increase our contact tracing, as we scale our epidemiological team, and we're scaling that up very actively, and of course continuing to promote using face covering. Scenario F tested these three variables with social distancing levels of 65, 55, and 45. Next graph. That's the correct way to cough into your sleeve. And we feel that giving our trajectory of testing capabilities to 33%, increasing by 5, the social distancing meets this goal of making sure that Coloradans aren't dying for lack of a medical bed, in most cases oxygen, in a hospital bed. We have the additional ones we built in the extreme cases, a ventilator or other extreme therapies. And we can actually even do it at 55% social distancing. If everything is working right, that's why we have that room that if we have the evidence, we hope to get the restaurants open sometime in May. But it all depends on how well you're doing with this, how well we're wearing masks, right? How well retailers are implementing the social distancing measures. We hope that there's some upside in that for this. But again, even with aggressive testing and containment, we can't just drop social distancing down to 45 or 40% anytime in May, or we really risk crashing the hospital system, Coloradans dying for lack of a bed that would give them a fighting chance. And I do mean it's a real fighting chance. I mean, for folks who enter the hospital, that 1 in 10, at least, hopefully 9 in 10 are coming out, right? Just fine. But they need that oxygen. And in those extreme cases, they need that ventilator. And we need to have it there for them. And it could be you, right? And if you're over 65, it's not 1 in 10. We're talking, that's where we were talking. It's like Russian roulette. I mean, this is why we're taking the additional steps to protect our most vulnerable. I mean, it's a very, very, very high risk, people in their 70s and 80s. And why throughout this month and beyond, those additional steps need to be taken to make sure that you stay safe. And I know you're doing that as seniors who are watching this. You are doing your best to stay at home, stay safe. May looks like April. We're doing more than we were in May, to step up those protections of those facilities. And I want to update you on that a little bit here as well. So next slide. So again, these are just some of the models that you saw, the raw numbers. Here's where we are in testing and containment, because I maybe, I'll take it on me. Some people, in the media and the general public are like, hey, what happened to testing and containment? Why aren't you focused on it? We were focused on this from day one. I just don't talk about it a lot because I thought you all understood that we were really focused on gearing up rapidly testing and containment, especially during this safer at home phase, right? During the stay at home phase, everybody's under quarantine. We're quarantined, whether you have it or not. If you're sick, you stay home. During this phase, the testing and containment becomes even more important. So we have partnered with Solgen, a Korean manufacturer, weeks of work. We validated 100 tests a week or two ago in our lab. We now have 150,000 tests arriving here by the end of this week. 150,000 swabs are also mid-May. We just got 20,000 swabs. We're partnering with Colorado State University to expand testing for workers at skilled nursing facilities that are testing our most vulnerable population. We've already had that. That's expanding a lot more in May than there was in April. We're one of the first states to do that, if not the first, to have the testing of asymptomatic workers at skilled nursing facilities. And we're very excited to work with the Gary Community Foundation. I talked to Mike Johnson earlier today to work with them to deploy hundreds of thousands of antibody tests to better understand disease surveillance and exposure. And remember, the antibody tests can also detect who had it already, and also we can pick up people that might still be in that contagious phase if they're symptomatic or non-symptomatic. They're not the same as those instant tests, but that's a huge part of this as well, and we're very excited to partner with Gary Community Foundation, and there's many others who are also doing some of this serological and antibody work across the state, and I just want to thank all of them for that. There's a lot more going on in testing. We might have a whole, I'd be happy to give an update on that sometime next week. Maybe it's Wednesday or Thursday after we get through some of the necessary things about the opening, the reopening, and what's going on for the safer at home. But just because I don't talk about it every day doesn't mean it's not the singular focus of an entire team of experts that we brought in from the private sector and other areas at our emergency response team. Sarah Thunberg, Casey Wolf, just a great team that's been working on this, Kyle Brown, with really good success. So what we really have here is an all of the above strategy, and I know that many folks have been focused on the testing and containment, a very important piece of the 4 pieces, but it doesn't work at all by itself. We have a catastrophe in Colorado if that's all that we were doing. This has to run alongside these other areas. That means maintaining the social distancing, right? Not the 75 to 80%. We knew that wasn't sustainable. That's the stay-at-home order. It's not sustainable, right? People have to earn a living, and they have to have that emotional and psychological fulfillment to be in this for the long haul, for the month of May, very likely the month of June. So we maintain that. Additional protections for our most vulnerable. Stay at home, except when absolutely necessary, exactly like you did in April. For a 74-year-old Colorado resident, May looks just like April. And that's very important, and we need to make sure that we're taking those additional steps at those nursing facilities to do the asymptomatic testing, meaning workers with no symptoms, because at least half the folks who get this don't have symptoms, but they can be contagious. They are contagious, can get tested. Increasing testing and aggressive contact tracing programs. What was built into the model was 5% increase per week. I think we can beat that, but we wanted to be reasonable in the modeling. Building more healthcare capacity. Those beds are online soon that I mentioned at the ranch in Loveland in Denver, some 50 in Grand Junction. Face covering wearing culture. We have to be able to do this. It's for this to work. It doesn't have to be a Broncos mask. It's allowed to be a Rockies mask or a Nuggets mask or an Avalanche mask too. It can actually be any mask that covers your nose and mouth. And what that does is a couple things. Of course, it prevents the particulates from coming in and going out. If you're contagious and don't know it, others won't get it. It can reduce the risk of you getting it as well. But one of the venues is surfaces. Without even thinking, if you don't have a mask, you're touching your own nose and mouth up to 30 times an hour. You don't even know it. It's not something you can consciously stop. The only thing that can really stop that is wearing a mask, and that's one of the main areas, especially if you're shopping. You're doing it without thinking about it. You're touching the same box that somebody else touched. And with COVID as prevalent in our state, tens of thousands of people have it, very likely somebody who's COVID positive shopped in that grocery store. So, I mean, this is very real, and this will be for the month of May. Wear those masks. We want to be as safe as possible. Of course, building more healthcare capacity, the face covering culture, and then hygiene, washing your hands. You get back from going out, you wash your hands with soap and water. I mean, Marlon and I are washing our hands so many times a day that we're becoming dry and chapped. That's actually good. I want to see those dry and chapped hands, Colorado. Post them on your social media. Show you're doing your part. Show you have dry and chapped hands. That makes us safer, right? And if you're not prone to drying and chapping, they won't be. But for most of us, yes, soap and water as many times a day as we should be doing it will lead to your hands being a bit chapped. Next slide, please. So these are the takeaways. The bottom line, we need to maintain sustainable high levels of social distancing. Our seniors and vulnerable populations maintain higher levels. And each intervention, testing and containment, wearing masks, strong precautions for seniors alone, none of those by itself keeps us below our hospital capacity. A successful strategy combines all of those interventions, and that's what we're doing. Just another anecdote about about one that worked. We've already had, we're one of the first states, if not the first, to do testing of the workers at the senior and nursing home facilities. We've had our Colorado National Guard at 3. We've already detected several workers at those facilities, at least I think 3 to 5 that were tested positive and are now not going to work. Those 3 workers, that could be 20 lives we saved right there. Right? 20 lives of people in their 70s and 80s at those facilities, 40, 50, 60 hospital beds for 2-3 weeks, and some would make it out and some wouldn't. But that shows the impact of that targeted approach to using our testing resources around protecting the most vulnerable, much higher hospitalization rates and much higher fatality rates. And we're going to be focused on doing more of that in partnership with CSU, as well as with the Colorado National Guard, prioritizing that for the units that are directly under my command. So that's really where we need to go. And at the end of the day, we have a choice. You have a choice, right? Depends on your actions. We could, of course, go backwards, or we could go forwards. And I hope that we go forwards. If we're successful in wearing masks when we go out, if we're successful at staying safer at home, we can get this done in a safe way. We need to make sure that we're moving forward in a way that we're meeting these goals and are able to further relax things and allow for a more sustainable enjoyment of life, more people to earn a living at any given time. That is really the goal, and that's what together we'll achieve. I am going to start a quick news section of this every day. My staff now is going, oh no, what's Jared doing? Don't worry anybody out there, it's not too crazy. I'm just gonna answer a couple of questions from the general public. I get thousands of these on my Facebook page and Twitter. You can send them in. I can't get to all of them. And I'm gonna pick ones that are critical, not just ones that say you're doing a great job. That wouldn't be too exciting. So I'm just gonna do 3 quickly today. Somebody tweeted, keep salons closed. We can't physical distance by touching people. Keep ourselves and clients and families safe. Wait and see for restaurants, even though they don't touch people. So just why, people say this, why salons, not restaurants, right? We get that people are touching people at salons. These are one-on-one services. Restaurants, 30, 40, 50 people, depends on how big it is. Bars, even more. So it's a mathematical thing. When you put any of these into the model, when you have 50, 60 people in an enclosed area, it's a very different risk to everybody than one-on-one services. So this first round is one-on-one services. That's what they are. We don't make any judgments about which one are more or less necessary. They're all critical. We know we need them. People earn a living and people need those services. But the fact that they're one-on-one is very different than having 40 on 40 in a group in a way that it just has a different impact on putting yourself at risk as well as society. Hillary said, I have a big and deep concern about the reopening of the state, even in a regulated way, so soon. Today, after the announcement of safer at home, maybe 25% of people at the grocery store had on masks, as opposed to roughly 75% last week. Apparently, the masking order was lost in the everything is back open soon message. I want to address that. This will not work if this is going from 75% to 25% people wearing masks. If anything, this should increase our mask wearing culture. As we trust people more, the number of folks that wear masks, grocery stores out and about, needs to go up. This needs to happen for it to work. Finally, last one from Mike, who I know, who posted, I'm a partner in a small Colorado business. We have a small but powerful law firm. Love the way he said, but powerful law firm. I will not ask our employees to return to the office on May 4th. I believe Governor Polis' decision to allow that is reckless and will needlessly result in the deaths of Colorado citizens. My business won't partake in such reckless behavior towards our employees and clients. Yeah, and I want to say thank you. That's wonderful. If you're able to not go back May 4th, you should do that as an employer. Not every business can. Some can exist if they can't go back in early May. People rely on those paychecks. But for you, Mike, and for businesses that don't have to go back May 4th, you shouldn't go back May 4th, right? Telecommute, stay home, stay safe. Safer at home means some businesses are going to have to go back, and many employees have to earn a paycheck. It's an economic necessity, right, for people. People simply can't make their rent if they don't have that income. Businesses will have no jobs if they're so it's an opportunity to come back. In no way is it a mandate to go back. And I applaud you, Mike, and your firm, and I applaud any employers that are able to make this work a few weeks longer without having folks come back. So thank you, keep up the good work, and we'll be happy to take some questions. We'll do the first from the room, and then we'll go to the telephone. Mary Ann.
Yes, why are you going ahead with opening the state when you don't have the necessary testing capacity? And what is our testing capacity now compared to the CDC's gold standard of 152 tests per 100,000?
So I hope that I addressed that in my presentation, Mary Ann, that testing alone at any level is not enough to reopen the state. I also shared for the first time some of the exciting news on testing. There has been weeks of work, but the 150,000 that are arriving this week from Solgent in Korea, the 150,000 swabs, the 20,000 we already got, we'll go back to that slide. We're one of the first states, I think the first, to do asymptomatic testing of workers at nursing homes, at least in an ongoing way. We've already done 3 major centers. We're starting with big ones and working our way down, both the Colorado National Guard, the partnership with CSU, additional work, hundreds of thousands of tests, Gary Community Foundation. I'm not even getting down to, Mary Ann, the details of the 5,000 tests here or there that we're getting, Routt County has 3 drive-through facilities, Pitkin County ordered 1,000 serological tests. I mean, this is happening all over the state in very important ways. No amount of testing is enough to reopen the state, if that's all you're doing. We are very excited about the progress that our team, working with our labs, working with the private sector, has done, and we'll be happy to do a more detailed presentation next week sometime after we get through this initial phase, hopefully Wednesday or Friday, about kind of what is really going on in the testing world, because it's an exciting world. I spend a lot of time there, several calls every day. We have so many people helping out that just were dropped what they were doing in the private sector and are like, we want to help on testing, as well as the isolation and containment side, the automated side of that, because it can't all be done by hand. From the telephone, please.
Good afternoon. It's David Kluge at Denver 7. JBS in Greeley has confirmed its intent to reopen on Friday of this week, despite very little testing by the 6,000 employees. Does that reopening come with your endorsement? And what can you say to those employees that are concerned about their safety?
We have worked very closely with both JBS and the union. In fact, I just talked to Jill Ryan, our head of Department of Public Health, moments before this press conference. Testing will absolutely be a part of going back to work, especially that community testing to see where it's at for roommates and people who live, as well as significant additional safety protocols at the workplace. We want, of course, the workers to be able to earn a living. We want them to be able to do it in a safe way. And we also value all the jobs and economic activity that the meat processing plant supports, as well as the need for consumers nationally to have an uninterrupted food supply chain. So we look forward to continuing to work with Weld County Health, Public Health Department, JBS, and the union to do this in as safe a way as possible. Next question from the room.
Governor, can you talk a little bit about what enforcement mechanism there will be to keep only 50% of people in the offices? And then on top of that, I've talked to some union officials who are worried about the folks who are going to be forced to go back to work, because journalists can stay home and work from their computer, but certainly there are people who have to work on factory lines, and these are people who are blue-collar workers who might be disproportionately affected by this partial reopening.
First of all, here's my message. This will be enforced. I mean, we had this whole stay-at-home thing, and we really didn't want and said we didn't want anybody to be, arrested for playing basketball or charged with a crime. That was never the goal of that, and it didn't I hope it didn't happen at all. If it happened once or twice, I don't agree with those local decisions, but by and large, this was not something that was enforced. We trust people to do it. The workplace side will be enforced, right? If businesses try to jam people in, believe me, it's going to be reported to us. You can send it to my Twitter or Facebook, send it to your county public health department. You say, oh my gosh, they have 100% back, I'm at risk. It's not like it's going to be a secret, Jesse, right? People are going to find out, and there will likely be a county health order, perhaps a warning first, but then an order for them to close down, for a period of time before they can successfully reopen. So businesses have to meet this, and in meeting that, in having up to 50% go back to work, you should prioritize the ability to telecommute or work from home for your most vulnerable employees, meaning you might very well have people that are in their 70s in your workforce. Those should be the folks that come in last rather than first, right? Or if it's a type of work that can only be done in person, you might have the people that come in during the day, and you have a even smaller number with more social distancing come in at night. But prioritize the telecommuting, work from home opportunities for those with pre-existing conditions and any seniors that are part of that workforce. And yes, this will be enforced. I had a conference call with the mayors just the other day. I bet some of them are watching this, not every mayor, but mayors, and they're getting the word out. I said, we expect that you will be serious about making sure your local businesses comply with these density and safety restrictions. And that means closing down a hair or nail salon that isn't meeting the guidance that we've given them, or a retailer. And yes, if offices are packing people in a way that's putting those workers at risk, we expect that we will have excellent partners in local compliance from our cities and our counties.
How about the blue collar workers, though? The fact that they'll be disproportionately sent back to work where white collar workers won't?
Well, the office is, I don't know, you call it white or blue collar. I mean, honestly, many of the so-called essential industries, some of those are blue collar, some are white collar. There's probably a greater part of blue collar in the mix. I think they traditionally call office pink collar, Jesse, right? I think that's what it's traditionally referred to. But I'm not. We're all in this together. I don't care what the color of your collar is. We want workplaces to be safe. There's going to be people of all different color types of collars and all different races and all different income levels that all have to figure out about a sustainable way to manage this risk, not exceed our hospital beds, give people a fighting ability to get through this, prevent workplace outbreaks during this month. And that's really the goal of this guidance. Telephone?
To get tracing to the point where you would like to be it at? And where do you want the state to be at in tracing, and how soon can we expect that?
4 ways we're doing that. The number 4 keeps coming up. There's 4 strategies around what May looks like and safer at home. There's also 4 ways that we're doing this. It just happens to be 4. And I've been on calls today about various incarnations of these. One is the traditional way. Epidemiologists, we're hiring more. They call the person, they find out who they were in contact with. There's quarantines for the people that they've been in contact with. That's very labor intense. We want to do more of it. We are doing more of it. We'll scale that up. That's number 1, more of what has been done for decades, more of it. Second, automating some of that. It's not going to be the same effectiveness as the kind of old-fashioned way of doing it, but we want to automate more of that, meaning people can do it through an app. They can do it in an automated way. So folks who we can't get to with a high-touch way are still able to have some positive impact of that with warnings going out. Third way, app, a symptom tracer app that's very exciting that we've been working on for some time, that the more people that use that, and we'll be talking about this next week, the better that will be. And then finally, building in more of a communications component to that app, making sure that we address the valid privacy concerns, work with stakeholders like ACLU and others to figure this out in a way where people can get push warnings. You were near somebody who might have had it, might be contagious. This is what works very well in South Korea. So all 4 of those at various stages. The most immediate ones, I pretty much listed them in the order of their impact and immediacy. The one we're already doing, the old-fashioned way, growing it. More automation happening soon, already happening, looking to roll that out. Symptom tracing app, which is tied into the first and second way of doing it because it informs that. And then fourth, pushing out a fully automated way of doing it. So all those things are in. Our modeling is we're really being very realistic about what we can achieve. We're just seeing a 5% increase in what we're able to do each week. We honestly, for the next few weeks, are largely doing that through the old-fashioned way and some automation through the symptom tracing. We have more upside over time to be able to get to some of those numbers. From the room? Yes.
In-person learning come the fall, or if it could be virtual again? And what about fall sports, particularly for high school?
Yeah, look, when I had a call with the superintendents, there were some articles that went out that I wasn't thrilled with. They weren't inaccurate per se, but they kind of sensationalized it. There were articles that say, Polis might keep schools closed through January. The question was along the lines, can you guarantee that school will go back in the fall? And I, of course, answered honestly. I said, no, I can't guarantee it. No, nobody can guarantee it. But we are expecting that schools will go back in the fall. I was very clear to the superintendents. I said, we want to prepare to go back in the fall. We'll have the social distancing guidelines about how to do that in as safest way as possible. You'll be able to implement them over the summer rather than rushing it for this year, trying to get something out the door only to train people and then have 1 week at school. didn't make sense. We'll be able to spend a few more weeks developing those. They'll be issued working with the Colorado Department of Education and our great education commissioner, Katie Anthis. Schools will have time to be able to plan for returning to in-classroom instruction in August in a safer way. Absolutely, that's the goal. There's nobody who can guarantee that that's going to happen. And of course, school districts should plan for different contingencies. But I am very optimistic that, that in-classroom instruction will begin in August. Not exactly the same way, right? It might mean, it might even, you know, it could mean a number of different things. It could just mean slightly different desk configurations in classrooms, different passing times for different students, things like that. But we're going to work very closely with the school districts, with the teachers, with the superintendents, with the principals to make that work. Sports are, there's two dimensions to sports. One are the players and one are the fans. The players is very realistic. We look forward to working with Chaza and with others to figure out how to do that. The fans are a little bit harder, right? It depends on venues and spacing and distancing and how many people go. But of course, we want to get to yes and figure out a way that that can happen in a safe way. That, again, the time frame for all of those school-related things would be the fall, and we hope to be able to have sufficient guidelines in place with the confidence that that can resume. Telephone, please.
Hello, Governor. This is Vinny Dalchunas at Bloomberg News in Denver. Colorado's population is 5.8 million people. So regarding testing supplies, swabs, plastic kits, reagent kits, orders versus deliveries, what challenge does Colorado face in building the right inventory? And you had problems here with FEMA, shall we say, stepping to the front of the line like you did with ventilators, et cetera. Thank you very much.
Yeah, that's sort of a reason why I haven't reported more, and I'm happy to do that on like what's happening with testing and PPE, which led to some unfortunate, conclusions. People thinking, oh, we're not doing it. We are, and I'm going to be more transparent about what's in the works because I think I learned our lesson, and we want to make sure you know what's happening. But the reality of this is, orders does not mean deliveries, and so we've been hesitant to tout orders. Because until they show up, and we've had a lot of disappointments, POs placed, ready to pay, didn't show up, delayed, something different than what we ordered show up. This is a very difficult time in the supply chain. We have some of the top people on it, we're figuring it out. But that's why now we're saying, look, the 150,000 tests from Korea, they are already in the process of clearing customs in the United States. They'll be here by the end of the week. I didn't want to say that last week because we just didn't know. They're going to be here in the next few days. We've already validated, and I didn't say that either. We validated 100 tests that they sent a week or two ago because we didn't know if they validate, right? And there's a million things we're doing like that. I mean, not a million, but hundreds. So we're testing this one, it didn't work, it did work. Every day, we're looking at things that work and that don't work. We want to report, and we only count, and I've said this a number of times to our supply team, we're only going to count on things we have in hand. We're not counting on what's in the pipeline. We're not counting on our orders because, yes, sometimes FEMA buys them up. Sometimes they never existed in the first place. Sometimes somebody else is paying twice as much as we're paying. But when they hit the ground, we're counting them, and we'll do a better job letting you know about them. And that's been the challenges of managing a internationally, globally disrupted supply chain in testing and PPE, two categories that it's been a free-for-all. In the room? Yes.
5% or a little higher every week. Is that because that's the max you can actually physically do given supply chains, or are you choosing that to not overrun the healthcare system?
That's testing and containment. That's what testing by itself doesn't accomplish much beyond everybody with symptoms should stay at home, right? That doesn't change. In May, if you're sick, you stay home. And by the way, the flu has just dropped off a cliff here because of the social distancing. So like hardly anybody has the flu now. It's gone down from normal levels to almost no one, which may mean if you have flu-like symptoms, it might be more likely you have COVID. It's certainly less likely you have the flu. But if you have symptoms, you stay at home, okay? The advantage of the testing is not just, oh, it's nice to know whether I had COVID. We all want to know. It's not that. That's not a public health benefit. The benefit is the tracing and identification of contacts, additional formal actions like quarantine orders for those who are exposed, and additional informal awareness level actions for people who are exposed. That's the harder part about the capacity building. How do we do that? And the 5% is just with the number that was plugged into the model so we could have one that we thought we had full confidence we could reach. We want to do more than that. But that's the modeling that was built into the model to say, look, the state will do an even better job over time, not just testing, but testing and containment and isolation. And that's what was built into the model, because it's not going to be the same number, and that was the model we presented last week. Realistic, achievable numbers of what we can expect to have in those areas at any given point in time.
So just a quick
Yeah,
follow-up.
go ahead.
At 5% per week plus wide scale of testing, plus keeping the social distancing percentage high, that doesn't put wide scale testing available in our state until July, but yet the peak would come in late April. So where did
Well, look, I mean, you're still obsessed with testing. I wish everybody was asking more questions about the other three things: the need to wear masks, the social distancing, and protecting our most vulnerable. I mean, I'm happy to answer any questions, don't get me wrong, and testing is very important. That's why I gave these updates today. 150,000 tests arriving this week, 150,000 swabs this week. Working with Gary Community Foundation, hundreds of thousands of serological tests, thousands here and there that we're happy to talk about and list, and we'll give a more detailed report. We can easily spend, because I spend a lot of my time in this world, how are we aggressively scaling up testing and containment. Next Wednesday or Thursday, we'll take you through that whole thing about exactly what's happening, including the things in early stages that are near delivery, everything that's in the work. It's very exciting, it's very promising, but even when it is completed and fully online, and there's whatever you define, as mass testing, it doesn't mean that you can ever say that you don't have to do anything around these other areas, protecting our most vulnerable, wearing masks, at least for those who are transacting business with the public, and of course, the continued social distancing. So we're going to get there. We're working very hard. We have a team to lead the way. Hundreds of thousands of tests that we've been successful in acquiring, and many times in competition with other states and other providers. Our private partners, our hospitals, our labs are doing a great job increasing the capacity. And we're going to need every test that we can do, because it all helps us reach these goals. And you know what? If it means that through aggressive focus on increasing testing and containment in a month, we're more successful than our models show, it means that you can have, 50% social distancing instead of 55, right? And that means a couple things. It means millions of dollars of economic activity, and it also means more psychological fulfillment and emotional fulfillment for our residents to know that they're in this for the long haul. So testing and containment is a critical, indispensable part of the overall equation. It's a critical tool. I gave you some insight into the plans and the news and the numbers of specific tests that are arriving in Colorado, that are here, that are on the way, that are ordered, that are being done already at senior care facilities. And we'll be happy to walk you through all of that next week. And I just hope everybody pays attention then. I hope this testing and containment isn't just this week's news cycle and everybody's on to something else next week. So please pay attention when we're presenting all that. We'll do it next Wednesday or Thursday. We just have to get through a lot of the safe reopening work and social distancing work around our necessary businesses, and then we'll get into a lot more detail. But I did want to provide some of that detail, just the numbers of tests, what we've ordered, weeks of work from our team, great people that have come in, are helping Colorado win in the supply chain battles, win in our competition with other states, with other countries. We are able to do this working with providers in South Korea, our own universities, domestic, local labs, and others in being able to make sure that we're a leader in this area. Telephone? Yes, go ahead.
Okay, great. We have been hearing about some rural districts that are planning to start bringing teachers and students back to school as soon as April 27th for in-person tutoring, and I'm wondering if this is in accordance with your decision to keep schools closed this school year. And then I was also hoping you could briefly address, you came into office with a lot of really ambitious plans for education and preschool, and how do you see those with the current budget situation?
Thank you. Yes, it is consistent with our guidelines, and actually was consistent with stay-at-home as well. Stay-at-home and safer at home. I actually have encouraged districts to use their buildings. What does that mean? You cannot have regular classroom instruction, but some students who need one-on-one special ed, perhaps some small groups that need technical facilities, if they need to complete their welding requirements, their vocational requirements, 5 at once, no more than 10 at once during the safer at home phase. Schools can absolutely do that. We applaud their innovation in doing that in a safe way, but not the in-classroom instruction with, hundreds or thousands of people in passing time interacting with one another, large classes, lunch periods. That's the piece that can happen right now. But we applaud the innovation and the work of urban, suburban, and rural districts to find ways to be able to use the resources they have to make sure that they're meeting the educational needs, particularly of students that need special education services and vocational services, but others that might need that small group or one-on-one contact. Look, I come from an education background. In addition to business, I was a founder and a superintendent of a charter school. A lot of exciting work for education. I would say the biggest goal and work that I'm focused on right now is making sure that every kid is able to achieve at the grade level expectations for next year. And the districts are doing a great job on the online, some better than others. We're working with the Commissioner of Education and the Department of Education to make sure that every kid is there, every kid gets there. On the superintendent's call, there's already some folks that are trying to make excuses and saying, wait a minute, after different national disasters that set kids back a grade level or two or whatever. And I just said, no. No one is not going to learn because of this. I know it's tough for 2 months to do the online. We're going to get there. We're going to do it. My kids are 8 and 5, online at home. Many families are. They're going to be ready for the next grade level next year. No excuses. And our educators, our principals, our districts are just stepping up in so many ways. And I know it's hard, and I want to thank you. Thank you, teachers. Thank you, principals. Thank you, district staff and superintendents. None of you thought that this school year would look like this. And that goes for parents, too, and kids in school. But it does look like this. And we're not going to sacrifice learning and education. And we're going to do everything we can to make sure that classes are able to safely resume in the fall. Next question, please.
Yes, quick question about state contracted employees. We've spoken with some state contracted employees in the admissions industry who are concerned about going back to work without any PPE. The question here is, when will state contracted agencies return to work? And as some employees are afraid that they're going to have to go back to work without sufficient equipment.
So I believe that all of the state contracted agencies are part of what was called essential, meaning they could have been at work all of April. We have done our best job as a state saying to the state workers and our contractors, and in our state, there's federal contractors, those were called essential, state contractors, local contractors, essential. They did, but even though they could have gone to work in April, we by and large, wherever possible, try to avoid the need to do that. And many have to because they're doing contracted services, groundskeep. I mean, they're physically working. They can't do it from home. Others can do it from home. We're going to continue to maximize the amount of contractors and state employees that can work from home. I was very proud that number is between 70 to 80% of state employees have been working from home these last couple of weeks. I don't have it for contractors. I might be able to get it, but the contractors would have to answer a questionnaire, and I can talk with our Department of Personnel and Administration to see if they can ask them. But just as we do for our state workers, we want our contractors to model good behavior, to have as many workers as possible working from home, and not more than 50% workplace density. One of them over there.
Yes, thank you. Governor, you talked a lot about the availability of beds and the expansion of beds, but in our reporting at CPR News, we found that there are still 18 hospitals reporting they're worried about shortages of PPE. And we're wondering where the equipment's going to come from, especially as you may start to authorize elective surgeries and that sort of thing. Those people will all need PPE as well.
Yeah, and I could, maybe what we'll do, since we're talking about supply constraints, we talked a little bit about testing. I could have a similar, slide for PPE. 100,000 arrived from Taiwan. We purchased 800,000 surgical masks, all the stuff that's there. I'll try to incorporate some of that into a presentation next week. We don't have as much visibility into exactly what each hospital is doing. They also have supply chains. Some are fine, others have shortages. But we have been working very hard to support that, not just support that from the state side, but also support some of the other needs for the high-grade medical masks, meaning senior care workers and others. We hope that as we acquire more of the protective equipment, especially the masks, that we'll have enough where once the immediate needs are met for healthcare, it's going, and it already is going to a certain extent, to some of these other sectors to protect our most vulnerable. So we'll be happy to have more granularity on that. That's another good item, just with numbers and orders and what's going on. It's another area like testing where I've been hesitant to talk about orders because we don't count it till it gets in hand. And there's been so many disappointments, orders placed, nothing delivered, under-delivered. But we will be happy to talk about that pipeline and open up a little bit about what's in the works and kind of share some of that information sometime next week. Telephone?
Question from the phone. Hi, Governor Polis, Kyle Clark at 9 News. Widespread testing is one part of that multi-pronged strategy. Yet it's so crucial
Very important question, and I want to answer this very clearly. The modeling that Dr. Samet, Dr. Herlihy did showed a 5% increase in the ability to do testing and containment each week during the safer at home period. And then beyond into June. So that's what it showed. It's the testing and containment that we will have, I'm confident we'll have, rather than the testing and containment that I wish we had. I wish we had 1,000 epidemiologists working for the state of Colorado today, that we had 50,000 tests being done each day in Colorado, including large swaths of the asymptomatic population. That's not the reality anywhere in the country. That's not going to be the reality in a week or 2 weeks. In the modeling that was done, they built in very reasonable expectations of what we can actually have for increased testing and containment with increases over time to be able to achieve that increased level of testing and containment that allow this model to sustain itself. If you have a follow-up question, Kyle, did I answer your question?
If I'm still
Go ahead.
here, thank you. So the opportunity now presents itself for local health departments to do what you decided not to do at the statewide level, which is to extend the public health order. Do you feel like your decision not to extend puts pressure on them to follow the state's lead, or would you encourage them to extend and give them your backing if that's what they feel they should do locally?
I think it's extremely important that local health authorities understand the situation on the ground in each area in making their decisions. We are, just as we're a big diverse country, we're a big diverse state. And what's right for Otero County might not be right for Denver City and County. We saw the work that Eagle County has done on the public health side. That will be one of the first recipients of a waiver. I think Mesa County also worked on it. We're having a more formalized process around a multi-stakeholder way to do that. There will also need to be counties that might have hotspots. Now, again, I would encourage them first, Kyle, to say do a site-specific or community-specific action. But if it's widespread, if it's not just a site-specific action, absolutely. They should take additional steps as a county, and of course, I would be supportive of those efforts as long as they're based on science and data.
Governor,
Last question.
Yes.
just quick questions from our reporter, Sean Shipnes. Self-employed workers who qualified for pandemic unemployment beginning on Monday say that they are still unable to get through by phone or online. Is additional assistance coming to this service?
Yeah, that's been rapidly scaling up. So I actually haven't heard anymore that people can't get through online. That was a problem initially. They should be able to. Maybe at a brief moment in time they couldn't. But the Colorado UI website, fully functional. Phones are, as you might understand, backed up. We're increasing capacity. We're taking more calls. The website should work fine. If it doesn't, let me know. But that was an issue a couple weeks ago. We've largely addressed that. The guidance just went out around the Monday on gig economy, independent contractors. A lot of people have questions about that. I understand that. You will be able to get your question answered. You won't miss out on a check because of it, but be patient as we're able to field all those inquiries as effectively and as quickly as we can. I'll just take one more from Jesse. Go ahead.
Governor, it seems like a lot of this press conference today was spent on kind of correcting the record, and it sounds like there's a lot of confusion, maybe among reporters and the public. Are you confident that people are going to be able to make this switch from stay-at-home to safer-at-home if they don't necessarily understand what the difference is?
And I'll answer this one in my mask, because wearing masks is very much a part of safer at home, just as it was during stay-at-home. So I put on my Broncos mask here. I'll take some of that on me, Jesse. I probably should have done a better job explaining what it looked like. The flip side of that is we have time to explain it. And some of it is explanations for you, the general public. Others is the technical guidance that is going to be issued around what salons need to do, what retailers need to do, what offices need to do. That's all issued in the coming days. That's not something that you or I need to read, Jesse, but anybody who's in business will need to read that, or controls the workplace, or a store owner. They will need to read that, and the press should report on it, because we want people to know what those requirements are. They're all going to be public. I think sometimes we get caught up in these national news cycles, and I'm frustrated by the national news. I watch it too. CNN, Fox News. I'm not saying it's not a side thing. It's just in talking about all this stuff, whatever you're watching, they're saying like opening, non-opening. This is not about like reopening or not reopening. It's about how you have a sustainable way of life for a period of time, for weeks and months. There's some, I think I used this metaphor a while ago. It's not an on or off switch, right? It's a lot more subtle than that. So I would love to see the national news media focus a little more on kind of these real issues. What is the guidance in this area? What's happening in this area? What's safe in stores? How you do it in a new way? Yes, curbside delivery starts in Colorado the 27th. Curbside delivery is relatively safe, less contacts, right? There's not a plan yet for those nightclubs and restaurants. That's later. There's things that are happening. I'm trying to explain them. I'm being the best communicator I can. I know I can do better. I'll try to do better. And I hopefully today help clarify some of that with the time to do it, Jesse, because the stay-at-home order is enforced through the 26th. And life doesn't change greatly on the 27th. There's just a new ways that we have to do things that are sustainable through safer at home. And I'm going to do as good a job as I can explaining those last week, or explaining them Monday, explaining them today, explaining them next week, all of the specifics that will be available to reporters, the general public, but most importantly to the businesses that need to implement them in the coming days. That's what's important. So I'm going to do as good as I can. And I understand there are a lot of questions here and desires for instance, more transparency and information about two areas, testing and containment, and PPE, that's masks and gloves and gowns. And we will provide that. We'll have a session next week where we walk through some of the numbers. I provided just a few today, but I'm happy to do that, and I want to be responsive to meeting the information needs of the public as quickly as we can. And I know that some are frustrated that, information needs aren't met fast enough. I just want to say we are doing, and I mean our emergency operations team, all of our folks are doing as good a job as we can, being as transparent as we can, knowing that, keeping in mind, and I know you have this in mind too, that we are building, this car as we're driving it. And so they're very hard at work building this system, and that means acquiring PPE, acquiring testing. We're happy when we can to take a step back and be more transparent about exactly how that's scaling up and exactly what our successes and failures and frustrations are, and we absolutely will. But as the executive responsible for the state, I can't detract from our emergency response effort to say, you know what, stop all this, we just want to focus on preparing nice slides. I can't do that. So I have to be able to do it in a way where we want to be transparent, we want to provide those slides, we want to provide that information, and we will next week in those two areas. But I can't remove the ball from the need to actually get these things done. So we're going to be, more transparent on this stuff. I'll do as good a job as I can communicating all I could ever promise. When I run for office, I avoid making promises. I don't like promises. People want you to sign this in your blood. It's an oath, and I never did that. But I said, I'll make you one promise. I'm going to do the best job that I can every day. And that's the promise that I have control over and can fulfill. I am fulfilling. I'm going to do the best job that I can every day. You're going to do the best job that you can every day. Wearing masks, avoiding unnecessary social interactions, staying safer at home whenever you can. And that's how we're going to get through this, Colorado. Thank you.